Walking into this patient's room, how would you assess for pain? Who is in greater pain? And who determines that pain? Pain is a subjective phenomenon that is present when the person who is experiencing it says it is. The person reporting is the most reliable source of information about its location, quality, intensity, and onset, precipitating factors, and the measure of relief. Hi, Tiara. My name is Stephen. I'm going to be a nurse today. Can I see your armband for your safety, please?
Sure.
Your name and date of birth?
Tiara DeLuca, 6/28/1996.
Great, thank you. Are you in pain right now?
Yes.
From 0 to 10, what's your pain?
I would rate it about an 8 or a 9.
8 or a 9?
Mm-hmm.
What are you on Facebook?
Yes.
Okay. All right, I'll be right back.
Okay.
Hi, Tiara. My name is Stephen. I'm going to be a nurse today.
Hello.
How you doing?
Good. How are you?
Good. Can I see your armband for your safety, please?
Sure.
Your name and date of birth?
Tiara DeLuca, 6/28/1996.
So when we were doing rounds, someone told me that you were in pain. Are you in pain right now?
Correct. I am in pain right now.
Can you describe that pain to me? Is it like a sharp pain, a stabbing pain?
It's like a sharp pain.
Okay.
That's constant. It won't go away.
Okay. How long have you had that pain?
I've had it since last night.
Okay. And where is that pain located? Where is it
It's
right
on
now?
my neck towards like the base of my skull. It really hurts.
So I'm going to ask you from 0 to 10, 0 being no pain and 10 being the greatest amount of pain, where do you feel you lie on that?
I feel like it's between an 8 or a 9, to be completely honest.
Okay. Is there anything that that pain is consistent, it's constant all the time?
It's constant, it's pretty consistent, yeah.
Okay. Is there anything that you do that, as you've had this pain before, is there anything that you do yourself that helps this pain?
No, to be honest, nothing really helps it.
What I'm going to do is I'm going to go back and see what we have prescribed for you for pain, and then I'll come in a little while and we'll take care of that. And if nothing, if anything else, I'll make sure I call the doctor and we'll get this taken care of for you.
Okay,
All right? I'll
thank
be right
you.
back.
The numerical pain rating scale is one of the most commonly used pain scales in healthcare. It is used for ages 7 and up to verbally rate their pain. 0 being no pain, 1 to 3 being mild pain, 4 to 6 being moderate pain, and 7 to 10 being the most severe pain. This pain scale can also be written for clients unable to verbally express their pain. The Wong-Baker Faces Pain Rating Scale is a combination of pictures and numbers for pain rating. Initially, it was developed for children because children understood cartoon faces and could point to the one that best expressed their pain. Now it is used for ages 3 and above. This scale is also culture sensitive, and it helps clients who may not know how to count or have impaired brain function. There are 6 faces in the Wong-Baker Faces Pain Scale. A happy face at 0, meaning no hurt, to a crying face at 10, which represents hurt like the worst pain imaginable. Flag Pain Scale is a measurement used to assess pain for children between the ages of 2 months to 7 years old, or individuals that are unable to communicate their pain. This pain tool includes 5 categories of pain: facial expression, leg movement, activity, cry, and consolability. This pain scale is based on observation. If the patient is awake, observe for 1 to 5 minutes. If the patient is asleep, observe for 5 minutes or longer. Each category is scored from 0 to 2 points to provide a total pain score ranging from 0 to 10. A score of 0, meaning relaxed and comfortable, a score 1 to 3, meaning mild discomfort, a score 4 to 6, meaning moderate pain, and finally a score of 7 to 10, meaning severe discomfort/pain.
Okay, so today we're going to be talking about pain management teachings that can help to meet the JCAHO standards. So the Joint Commission Accreditation of Healthcare Organization is what JCAHO stands for. So Advantage Home Healthcare in Georgia has devised a 3-page patient guide to pain management, which meets the JCAHO standards. So we're going to be talking about this today. We're going to discuss how to assess the patient's pain barriers to managing pain, and pharmacological ways to manage pain versus non-pharmacological ways. So upon doing a head-to-toe assessment, we want to ask our patients if they're having any pain. When we're palpating anywhere, if we see that the patients are guarding, or if they verbalize that they have pain, then we want to use a pain scale to rate the pain. Normally in adults, we use the 0 to 10 scale, 0 being the least pain, 10 being the most pain, and we ask the patient to give us a number. We want to know the location of the pain, we want to know the rating. We want to ask the patient to describe the pain. Does the pain radiate anywhere? Things that makes the pain better or worse are some of the questions that we have to ask our patients. If the patient level is greater than 3, then we want to use the appropriate pain management intervention. So Tylenol, for example, we would not give a patient who rates their pain 2 or 3 morphine because that's just too much. So after we ask the patient to rate their pain and they give us a number, then we do the appropriate pain management. Patients have the right to refuse pain medication. So if the patient says that their pain is 3, but they do not want the pain medication, that is okay. All we have to do is document that the patient refused in our chart. But let's say the patient does say that they have pain and we give them pain medication, then we want to reassess the pain level within an appropriate time frame. Normally this is within 1 hour of us giving the pain medication. Pause. Some other ways that we can manage pain, which are called non-pharmacological management, as everyone knows. Some of these examples include deep breathing and exercises, aromatherapy, we can use music therapy, we can use distractions such as allowing patients to watch TV, to listen to nature outside. These are just a few examples of non-pharmacological measures that we can take